Hello, my name is Burton. I'm an emergency physician and I'm the inventor of the DisImpactor, which is a novel clinical device for the treatment of fecal impaction. I'd like to welcome you to this brief instructional video that's brought to you by Nuvomed, the company that will be bringing the DisImpactor to emergency departments and clinical settings nationwide. In this brief video, we'll talk a little bit about fecal impaction and its diagnosis. We'll discuss the current state of the art for treatment. We'll introduce and explain the DisImpactor, and then we'll go through a DisImpaction procedure demonstration so that you'll understand how to use the device. At the end, we'll review some tips and strategies that will optimize your clinical experience. So let's begin by discussing briefly fecal impaction. As you know, patients present very often with constipation, which is a decrease in the frequency of stool passage, often accompanied by crampiness or other abdominal symptoms. But some patients are able to pass stool only as far as the rectal vault, where it might accumulate into a much larger mass that the patient cannot pass. That causes rectal pain and fullness, sometimes with the passage of loose watery stool around that, and patients present to the emergency department where, on a digital rectal exam, you would confirm that they indeed have a fecal impaction. Typically, the way that a fecal impaction is currently treated is that we all have a natural device for it on our hand, which is using our gloved, lubricated finger. We've all done this procedure and we know its limitations. It's embarrassing, uncomfortable, and frankly painful for the patient. It's certainly unpleasant for the clinician, and I think we would all agree that it is our least favorite procedure that we perform. Beyond that, though, it's also disappointingly ineffective and inefficient, and we've all had that experience where we've treated the patient multiple times. We've been in and out of the room doing disimpactions and doing enemas, and we still haven't relieved their problem. That's time-consuming and hurts the throughput of your department. It's certainly not fun for the patient, and many of those patients end up hospitalized, some even undergoing an exam under anesthesia. It's for those reasons that it occurred to me there has to be a better way to address this problem, and that's why I invented the DisImpactor. So let me go ahead and introduce the device and show you a DisImpactor and how that will keep you from having to perform digital disimpactions at all.